Wouldn't it be great if you could just take a pill to lose weight? But be careful what you wish for. In the last few weeks, the FDA approved 2 new weight loss drugs, and doctors warn you need to be aware of what they'll do to you. Dr. Dale Blanc is a family physician. He joins us live this morning with more on these new drugs. Good morning, doctor.
Good morning, Megan. Thanks for having me back.
Yeah, and it's important that we talk about this. The first one, Belviq, and then Qsymia. First, talk about the difference between the two and what they're supposed to do in terms of helping you lose weight.
Sure. Well, Belviq has not been released yet.
Okay.
But it is kind of the second generation of the fen-phen craze that went on several years ago. Belviq has been pharmaceutically altered to allow for it to hit different kinds of serotonin receptors in hopes then of causing the appetite suppression that we're looking for in the use of these drugs.
All right, and Qsymia, how does that one work?
Qsymia is a combination of 2 off-patent drugs, phentermine, which was from the fen-phen craze, and that's an immediate release drug, and then topiramate, also known brand name Topamax, an anticonvulsant drug, controlled release, and the two have been put together to not only help with appetite suppression, but we also know that topiramate does cause weight loss just by its use in patients that are using it for seizure disorders and migraines.
So when you hear about these drugs, you think about who might be able to take them. I guess what type of group are these drugs targeting?
Well, there's 2 indications that the FDA has allowed these drugs for. One is if you have a body mass index greater than 30, which puts you in the classification of obese. Or if you have a body mass index greater than or equal to 27 and you have one of the following chronic diseases: hypertension, diabetes, or hyperlipidemia, hypercholesterolemia.
So it's obviously for people that may be very overweight, not for someone who's trying to drop 10 pounds.
Yeah, these are not cosmetic drugs. These are the first 2 drugs in the last 13 years that have actually been approved because the FDA believes that obesity is a chronic disease. The other drugs were released years ago, mainly for cosmetic reasons, if you will. Xenical, also known on the shelf as Ally, and Meridian, which was by prescription. The problem is that as the drugs were released, they began to realize that after using these drugs for long term, the serious side effects began to play out.
And let's focus on that. In the short amount of time we have left, what are the side effects of taking these 2 drugs?
Well, first of all, Belviq, which we know can possibly at high doses hit the same receptors that if you took LSD, for instance, would hit. So they're very concerned about addiction, physical tolerance. So that's why that drug is at a very low dose and will be controlled. Both drugs are contraindicated during pregnancy. So you will see a pregnancy registry for both. Women will have to, if they are given the drug, be tested monthly for pregnancy and stopping the drug immediately. The topiramate phentermine combination, we worry about the side effects neurologically, gastrointestinal. We also worry about birth defects on topiramate with cleft palate, cleft lip, and of course the cardiovascular side effects of phentermine, which can be accelerated heart rate, possibly in high doses, causing a myocardial infarction.
Yeah, and so obviously there are some side effects. As always, make sure to talk with your own doctor about these drugs. Make an appointment to see that doctor. All right, thank you so much for coming in and chatting about this very important issue.
Thanks for having me.